I'm looking into getting dimpleplasty. However, I have braces. Would my braces cause any issues during or after the procedure? Thank you for your time.
Thank you for your question. You're asking about having dimpleplasty performed, and you're concerned about having braces. Well, certainly I can give you some guidance about dimpleplasty as it relates to braces. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial, plastic, and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years, and dimpleplasty has actually been one of the areas of recognition for our practice. People come from around the world for dimples, of all things, to our practice. And in fact, that we've been featured in various media regarding dimples. So just to kind of understand the concept of how dimpleplasty works and what the relationship of braces have to do with this procedure. First of all, understanding that people with natural dimples happen to have this natural opening in a muscle called the buccinator muscle that has this connection with the skin, and so when they smile, the skin kind of goes in and creates a dimple. Well, when we do dimpleplasty, generally speaking, we work on from the inside of the mouth, create an opening, and attach the muscle to the skin to then create a dimple. Now this dimple is always there in the beginning so that there's a connection and eventually softens with time so that you only have the dimple when you smile. Now how do braces fit in this? Well, it begins first with just proper oral hygiene. One of the things that I emphasize to my patients is when you do surgery inside the mouth, you're dealing with an area which naturally has a lot of bacteria. So we go through precautions such as placement on oral antibiotics and have patients use antibacterial mouthwash. But when it comes to braces, that it becomes even more important because good oral hygiene is important to prevent problems with the teeth from bacteria being stuck around the braces. So I would even further emphasize the importance of good oral hygiene prior to undergoing dimpleplasty. Now whether that's the use of water picks and everything else to make sure that food is cleared and that there's minimal chance of bacteria, you want to have those practices in place. Now logistically speaking, for me or for any surgeon, when someone has braces, there is the possibility of some of the gauze or other instruments just kind of interfacing with the braces, so sometimes the gauze can get stuck a little bit and we just have to be a little careful. Otherwise, I see no reason to not get dimple procedure because you have braces. I think it's very important to go to someone who is very experienced with doing dimples. I think that it's very important. It's kind of one of those procedures that looks like it should be simple, but it is deceptively complicated to really perform with consistency and with facility. But like anything else, an experienced surgeon is going to be very good because of the continual practice and experience. So that being said, I think that finding an experienced dimple surgeon to have your procedure done with, understanding that the braces does play a small type of inconvenience in the technical aspects of the surgery, will help you achieve a more likely successful outcome. So I hope that was helpful. I wish you the best of luck. Thank you for your question.